first of all, I want to thank all of you for joining us on this Saturday. It is not easy to wake up on a Saturday. I know a lot of us have competing demands. We have things that are happening all around us. And one of the things I want to make sure that I just share is that, you know, at this present moment in time, we know that we're in the midst of the pandemic of COVID. We're also in the midst of a pandemic called racism, and reconciliation to that and healing. And I just don't want us to be remiss that this is a moment that we're in, and a lot of us are carrying a lot of weight on our shoulders because of that. But nonetheless, I want to welcome you to this year's Oakland Early Learning Symposium, Navigating the New Now. And as we started planning for this year's symposium as compared to last year, there were a lot more knowns than there is now. And so as we started planning, we took in consideration that this year's symposium really needed to include what it means to navigate in the uncertainty of COVID, and how were people and programs and educators and childcare providers and early learning programs trying to figure their way out through all of this. None of it is easy, but we also know none of it's impossible. And we hope that this forum is a space for you, not to just ask questions and hear from some of the amazing speakers that we have lined up today, but we also want to look at ourselves as a collective. We can't do any of this work without one another. And so I want us to see ourselves, we want you to see yourselves as being creative and thinking about solutions of what can be. We easily could go down the rabbit hole about what's not possible, but really this is a space to say, yeah, I'm grappling with this, but on the other hand, what are the possibilities of how we can solve these problems together as a collective? And try to figure this out. And then we'll talk about in the coming months, we're also going to create space, because this is a 4-part webinar series that we're going to offer. And we're also going to offer in between those symposiums, or in between the symposium webinar series, a host of events where we can still come together and meet and talk in between those times, because things are going to come up more frequently than we like. So we're really excited to have you here. I have a script, but I'm trying to just be me because that's who I am. And I just want to make sure the last part of this is also see yourself as being able to raise ideas and use the chat feature at any point in time to share those ideas that are coming up, or throughout the webinar that we're on today. We'll try to look at the raised hands. We may not get to all of you, but those that we can get to based on time, we will like to actually have you unmute yourself and just hear you speak out loud. So I am now going to turn it over to my amazing Executive Director of Oakland Unified School District. She is our Executive Director of Early Learning, and I don't know how she does it all, but she does, and she even agreed to co-host with me because she does this really well. So she's going to go over a few housekeeping items, and if I missed anything with my other coordinators, please be sure to step in, but Christy's going to go over housekeeping for us.
So like we said before, we're going to be monitoring the chat, be able to answer questions, really encourage you to put your thoughts in the chat as well. We will be recording this webinar, and we'll push out the PowerPoint presentations. We will not be taking any screenshots or recording in the breakout room. And you don't need to video for now, because we'll have all of that information for you later. Again, we are going to continue to monitor the chat, answer any questions that you might have. I know a lot of our amazing educators are joining, and will be receiving the AB 212 credits, and we'll email those out to you after the event. Can you go to the next slide, please? So most importantly, this is not possible without our amazing funders. We have 2 incredible funders who believe deeply in early childhood education. And that's the David and Lucille Packard Foundation and the Kenneth Rainin Foundation. They have been long supporters of Oakland, and we are incredibly thankful for their support, sponsorship, and encouragement and leadership that they provide early childhood in the city. Can you go to the next slide, please? You know, this whole symposium would not be possible without true partnerships. And the one beautiful thing about being in Oakland is that we are a true collaborative community, and partnerships matter. So this symposium is presented by all of the amazing people that you see on this slide. We are a proud collaborative through Oakland Starting Smart and Strong, and we believe strongly in the work around early learning. Next slide, please. I'm going to turn it over to Priya.
Great, thank you, Christy. Hi, everyone. I am Priya Jagannathan with Oakland Starting Smart and Strong, and I have some raffle prizes. For those of you who were there last year, you know we were able to have some raffle prizes, and we're trying to, as much as possible, replicate some of the fun things that we did last year in this new virtual format. So I pre-selected through a random number generator folks from our registration, and we have some wonderful raffle prizes from Lakeshore. The first one is a gift card, and that will be going to Phyllis Leslie. So Phyllis, we will contact you directly and figure out a way to get that gift to you. Congratulations. And then our next raffle prize will go to Chan Sen. And I believe you both are here, so congratulations. Again, we will send you the information on how to get your raffle prize from Lakeshore after the meeting. And I will pass it back to Luanda. Thanks.
Yeah, thank you, Priya, and congratulations to the winners. So as we continue on with the next 2 hours of our time together, less than 2 hours of our time together, we are going to hear again from a number of speakers, and in order to take in a lot of the information that's coming in and to really center ourselves, and like I said, we're trying to also really, you know, think about COVID in a way of what's possible, and we're also trying to look at how we can start healing from this this thing called racism, and just really being able to be centered. We know so much is going on around us, so I want to invite us into this space right now. And you can choose to keep your video on, or you could turn it off. It's up to you. But I'm going to invite you to do some breath work with me. It's going to be, you know, just really quick. But one of the things we want to make sure, in order to be centered and taking all of this information, it's important that we start to just think about who we are in this moment together, and how we can really be focused on what's coming up for us. So what I'm going to do is invite you to keep your eyes either open or closed. And as your eyes are open or closed, I want you to take a long, deep breath in through your nose at the count of 5. So start with me now. 1, 2, 3, 4, 5, and then slowly exhale through your mouth. 1, 2, 3, 4, 5, and then just go whew and blow out. All right, so that's our centering piece together. Now that you're all ready to take it in, we are now going to pivot back to Christy Herrera.
Thanks, Luanda. So I'm just reading the chat about the interpretation. So again, if you see the globe, you're going to click on it and select the language that you need. So again, if you click on the globe, it'll say English, Chinese, or Spanish. If you do not see the globe, there was some advice to exit out of the full screen to see the dots. And if not, you can just stay here and we will continue to support you. So I really encourage everyone to be in whatever space you need to be. So take a break, be off screen, be on screen, walk around, stretch, whatever you need to do, take care of yourselves during our time together. So I want to turn it over now to Lisa Erickson. Lisa is the works for a family partnership and elementary school coordinator for Alameda County Public Health, and has been a long-term advocate and professional in the field of early learning. We're really excited that Lisa is here with us today. She's going to give us an update on safety strategies for childcare and different guidelines that are coming up through Alameda County Public Health. Lisa, we're so happy you're here.
Hi, everyone. Good morning. I just wanted to thank you for inviting me to the Early Childhood Symposium. It's a privilege to be here. and to be partnering with you all. It's been a very difficult 4 months, and I've been working with all of you since March, answering lots of questions, developing guidance, and really just trying to support the field as best as we can, given that it is a, it's always changing. Every week it seems like there's some new guidance or new policies to have to sort through. So I just wanted to recognize you all for sticking with this and for doing this just crucial work in our county. Next slide. So these are just some of the topics we're going to cover today. I'm sure you have lots of questions, so we might not get to everything, but I'll try to highlight some of the key things that have been coming up for us over the last 4 months. And then any questions that we don't get to, we can also follow up after the symposium. And I did hear Lawanda or Christy say that they're going to be doing a series of webinars. So I'm also happy to help with those webinars or to bring some of those answers to those webinars as well in the future. So what we'll first start with is a situation update and go into a little bit of a high-level overview of some of the big health and safety topics. And then lastly, I'm going to go over some of our processes and procedures, protocols for when you have a positive COVID-19 case in your program. Next slide, please. So this information is on our website, and this is how we assess our data for Alameda County and how close we are to reopening. So how we kind of move through our stages. These are the different indicators that we're looking at. So I'm just going to give you a really quick update. So as of today, we have 17,847 positive cases in the county, 198 hospitalizations, and 247 deaths. And this is also including data from Berkeley as well. And we remain on the state's monitoring list. And this means that our case rate is about 125 per 100,000 people or residents. And this threshold case rate for coming off the list is 100. So we're getting close, but we're not quite there yet. I should also mention that the state just released a new way that they're looking at the monitoring list that we're all kind of learning about right now. So you might hear about that in the media. So the other indicators to see here, you can see there's 5 basically dots that we look at. Some we're doing great on, some we're not quite there. Our case rates have stabilized since mid-July, although our hospitalizations have steadily increased. And that indicator, that's why that indicator there is 3. And we do have sufficient hospital and surge capacity. And our testing capacity is definitely doing better. We've done about 4,400 tests per day across 10 community sites. And our positivity rate is at 5%. And also lastly, for our disease containment, which some of you may have heard what this is like case investigators or contact tracers. We've definitely increased those. We have, right now we're at, 135 staff for doing the contact tracing. Next slide. And this is our reopening plan, and you can also find this on our website. Right now, as you can see where it says 8/28, that's where we are right now in our reopening plan. And then, as we do better on those indicators, we can move through those arrows. All right, next slide. And this is just sort of a general how we look at the risk across all these different environments, what's lowest to highest. And again, this is something that you can look at on our website. It's pretty easy to find. It's our reopening plan is what it's labeled on our website. And this is how these are all the different from lowest to highest risk different environments. Next slide. Okay, so now I'm going to get into some of the basic health and safety guidance and requirements that public health has been promoting during this time, basically since March. Right here, this is the big one is the cohorts and group size. And I'm sure many of you have already been implementing the cohorts. The big change that just happened a few days ago is that the state increased the group size to 14. So we have to, it's a little confusing because in our childcare, our new shelter in place order, it says 15, but we have to go with what the California Department of Health says, which is 14. So this means that when you operate your childcare, you need to have a stable group of 14 or fewer children, and no more than 2 staff with that group. And those groups, and when we say stable, that means that the group needs to stay together for at least 3 weeks, and the group should not mix. So we really want those groups to remain separate. There's lots of reasons for this cohorting and group size. When there is a positive case, it's much easier to determine, the contact tracing and who has had the close contact with that positive case when you have a stable group. The more mixing that there is, it's very difficult to do the contact tracing and determine who is exposed. It's also safer to keep kids in that smaller group so that there's less exposure when communities are mixing, if communities are mixing across the child care center. Next slide, please. And face masks. We get so many questions about face coverings and face masks. So we thought this slide would be helpful to just point out the state guidance and the county public health department guidance. So for children under age 2, it's never okay for them to wear a face mask or face covering. For children over 2, we say that they should wear, or they're strongly encouraged to wear, a face covering or face mask. Again, this is something that we want to be promoting in childcare. We're trying to really get kids ready for school. And unfortunately, we're probably going to be faced with this for a while. So it's really good to be kind of working with kids so we can all have this be the new norm of wearing face coverings. This isn't meant to be a punitive thing. We're not trying to punish kids for not wearing face masks, but it really is really strongly encouraging them to wear them. Also wanted to say something about face shields. They're not recommended unless you wear a mask underneath the face shield, or if you have some sort of cloth covering that falls below that is attached to the face shield. Because if it's just a face shield, droplets can kind of get out from around the face shield. So you need to wear both if you are planning to wear a face shield. Thanks. Next slide. And physical distancing. By now, everyone has heard the 6 feet guidance. I just wanted to point out this isn't a magic number. More space is always better, but 6 feet is what we've been promoting as the ideal ideal physical space that we're looking for safety. We know that in childcare, this is very difficult. Young kids are not going to be physically distancing very easily. So that's another reason why we have these stable cohorts. So it's expected that kids in some cases, we will not be able to physical distance. And so that's why the stable bubbles or stable cohorts are even more important to limit the spread of this virus. Also wanted to mention that children from different bubbles, this question comes up a lot, can share the same bathroom. Just try to stagger how they share that bathroom. And so just have the different cohorts maybe going in at different times, but try to stagger that use as much as you can. And lastly, we do get a lot of questions about, infant and toddler providers, and can they hold the infants? Can they be close to the infants? And of course, yes, that is expected. And again, this is why we have these stable cohorts, because we know it's going to be really tough for that physically distancing to happen in childcare. Next slide, please. Health screening. This is something that's a requirement for all children and youth settings. In childcare, for sure, this is a big requirement. And there's just 3 screening steps. I'm not going to go into, we don't have time today to go into all the details of what encompasses a health screen, but I did want to point out the 3 big picture steps. The first one is that you have to ask about COVID-19 symptoms. The second is a visual check. And the last is a temperature check. And you can find more information on our website, and all of the links where all these resources are in this presentation, and you can access those links on the website. Next slide, please. So these are all the symptoms that you need to be looking for COVID-19. Again, I'm not going to read out all the symptoms. I'm sure you're all pretty familiar with these symptoms by now. One thing I did want to point out, though, on this slide is that we get lots of questions around what happens with mild symptoms. And of course, we're getting these questions because for little kids, as you all know, they always have runny noses. They're always getting, they get sick a lot. So this is very challenging in a childcare setting to be kind of always, to be having to think about all these mild symptoms. The one thing to keep in mind is that we're really looking for new symptoms. So if a child has allergies, for example, hopefully the parents and the child care program knows what to look for allergies, as opposed to something that looks very different from regular kind of more chronic symptoms. The other thing to keep in mind is that if a child is sent home with any of these symptoms, in order to come back, even if they were mild symptoms and new mild symptoms, they would need to get a note from their medical evaluator. Okay, so they can't just come back like they would normally in sort of pre-pandemic times, right? They would need to get that medical evaluator note. And we can talk more about that later in the protocol slides in this presentation. Next slide, please. All right, so now we're into answering questions around what to do when you have a positive case. And this is also what to do when you have symptoms in your child care program. We've been working since March, kind of partnering with child care programs around this and working out our protocols. And we've been learning a lot since March about this as well. So we've really been learning together around how to do this best. But we were able to develop some protocols. So I'm hoping that this will help you all think about these situations on your own, even before you call us. So next slide, please. The first part of this is preparing, right? So in your policies and procedures, really think about how you're going to be responding to this as your child care program. The first most important thing to do is to have a staff within your program to track and report positive cases. You're also going to want to be tracking the symptoms or as kids are absent in your program as well. But for this, it's tracking and reporting positive cases. And what we're calling these people, these contact staff in your program, as a COVID liaison. So it's important to have one COVID liaison at least for your organization. And this is really important for communication. I know that some child care organizations have many different sites. So ideally we would have one COVID liaison for the entire organization so that we're not getting lots of, contacts from different staff across the entire agency. So one person to kind of monitor all the positive cases coming in. And developing a communication protocol. So making sure that you're prepared to notify your community when there is a positive case. Be really conscious of that. This is you don't want to, you need to consider privacy. And when you're being transparent to the community, just make sure that you're not, you're trying to really protect the privacy of the individual as much as possible. And also be aware of stigmatizing a particular site or group of people when you're doing this communication. And again, we're here to support you. So if you have questions about that, we have templates and we can help you craft that messaging if you need. Next slide, please. And just sometimes this is difficult, but try to obtain documentation when you have a positive COVID-19 case. Next slide. And internal notification, again, making sure that all the staff in your organization know that when there is a positive case, to tell the COVID liaison so that COVID liaison can then tell the public health department. Thank you. Next slide. And this is our information around who you need to call or email when there is a positive case. And I should also mention that you can also call these numbers when you just have questions, just general questions. This is the email, safelearning@acgov.org. So make sure you save this email, it's very important. And one thing also wanted to mention here, that right now we'll ask a series of questions when this happens. You can give us answers to those questions via email, but we are developing a form that we're going to be having everyone fill out when there's positive cases. Next slide. All right, so what happens when there's a positive case? What are the things that we ask for? Like I just mentioned, we'll ask you to answer a series of questions. We also are going to ask that you help us identify who in your program has had close contact with that positive case. And how we define close contact is someone who was in close contact with that positive case for shorter than 6 feet, for longer than 15 minutes during the time that case was infectious. So that's the definition, and it's written down as well in a subsequent slide that I'll show you. And then based on those dates, the public health department will then help you determine who to quarantine, how to quarantine, and who to quarantine. And then also to send out exposure letters. And I just saw Paige mentioning in the chat, I forgot to say that there's guidance that's included in your list of resources for all of these protocols and procedures. So the guidance is all written out. I'm just kind of giving you a high level overview today. Thanks, next slide. And again, this is the exposure letter. So this letter would go out to all of those individuals in your programs that need to quarantine. And we would help you develop these exposure letters and fill in the dates. There's a sample that's in this guidance. Next slide. And these are some of the frequently used terms. I think it's especially important to remember the difference between isolation and quarantine. So I wanted to point that out today in particular, because people often get confused. And the reason why it's important is that there's different instructions for if you're isolating or if you're quarantining. Okay, so isolation is for someone who's sick. Either they have symptoms or they actually have COVID. That means they're isolating, and then they would need to follow isolation instructions. If you're quarantining, that means that you've been exposed. It doesn't necessarily mean that you're sick or that you have symptoms or that you have COVID. It means that you've just been exposed, and that means that you need to quarantine for 14 days. Okay, thanks. Next slide. All right, so now I'm going to go through, I believe I have like 3 scenarios. They're a bit involved, but I'm going to try to give you just kind of a high level picture of what happens in these scenarios. And there's always going to be some nuances and questions. And again, that's what we're here for, the Public Health Department. We can help you work through these, but we wanted to at least give you something to refer to, you know, because you might not be able to reach us right away, so that you know what to do. So the first scenario is someone in your program who says yes to one of those screening questions. All right, they go home with one of the symptoms. They have a fever or they have a sore throat. You send them home. What to do? Next slide, please. This is what you would need to do. You need to send them home, encourage them to contact their healthcare provider. They might consider testing. And if they did test, they would need to share those testing results with you ASAP. And again, follow the isolation instructions. And the instructions, the isolation instructions is in that guidance. And all these instructions can also be found on our website. We don't have time today to go through everything, but I did want to just point out that those resources are there for you. When someone just goes home sick, there's no need to communicate to your entire program that someone left with symptoms. If they got a positive test back that said that they had COVID, that would be a different situation. But for this, there's no action needed, aside from sending them home. Next slide. All right, so this question comes up all the time. This is a household member or someone in close contact with a child, student, or staff member tests positive for COVID-19. So this is the situation where you hear, you know, there's a child in your child care that the parent tests positive. What do you do? Next slide. What you need to do in this situation is you would send that child home, send the individual home, the staff or the child home, and you would tell them that they would need to follow quarantine instructions and they need to stay home for at least a minimum of 14 days. They also should contact their healthcare provider and consider testing, but there's no communication needed at this point, and you don't need to close your cohort. So if it's just one person in your cohort or your program that has been exposed, that means that that person just needs to go home, but you do not need to close your cohort for this situation. I did want to point out one thing about quarantining. Sometimes quarantining for kids can be tough because they might not be able to separate from that positive case, if that makes sense. They can't isolate from, like, the mother, for example, who's caring for the toddler. So they might actually need to quarantine for a little bit longer than 14 days. And those instructions are in the quarantine instructions. And again, we're here to help if you have questions. All right, third scenario. A child or staff member tests positive for COVID-19. So I already went through the process of what you do when you have a positive case. You contact us. Next slide. But this is when you do need to start thinking about and finding out who the close contacts are, and you need to quarantine that cohort. So you don't necessarily need to shut down the entire childcare center, but you would need to quarantine that cohort, because presumably that teacher or child that was in that cohort did have close contact with everybody in the cohort, which means that they were within 6 feet distance for longer than 15 minutes during that infectious time when that person was infectious in the childcare program. So these are all the steps that you would need to take. And also clean and disinfect that classroom and all the primary spaces where that cohort, where the positive case, where the individual spent time. And then again, notify us. And that's when you would need to complete the exposure letters to everyone in that cohort. All right, next slide. Oh, this is the last slide, I believe. These are some of the resources that I had mentioned that you can find on our website. Again, I didn't have time today to talk about all the different nuances with all those scenarios, but we're here. You have the email, you have the phone number, so please call me with any questions. We are here to support you all. We know this is hard, and we're here, and we have to, like we said earlier, this is a partnership, and we're here to help keep your program safe and to answer questions. Thank you very much.
Thank you, Lisa. And we really encourage everybody to put questions in the chat. We will be reviewing the chat later and sending out any answers to the chat that maybe we couldn't answer during the presentation. So again, Lisa, thank you for holding this really important work in the county. And your consistent guidance, your clear guidance has been really appreciated, specifically in the city of Oakland. I'm going to turn it over to LaWanda, who's going to introduce our next presenter. And again, please take a break if you need to, stand up and stretch, have some coffee, some water, whatever you might need. Thank you.
Hi, everyone. I'm back again. I have the pleasure of introducing Kim Johnson, who I have come to know over the last 3 years, who is a dedicated spirit, soul, sister in the work. And with further ado, Kim Johnson is the executive director of Bananas. And Bananas is a program, a resource and referral program that offers resources to families and young children who are looking for childcare resources. So Bananas is in northern part of Alameda County, and they service Oakland, Berkeley, Albany, Piedmont, Emeryville, Alameda. Kim is also an active member of the county's emergency childcare response team that was formed just in March, everyone, just in March. And when they formed, they started responding to the pandemic immediately. So we would like to again introduce Kim Johnson, who's going to talk about how she, along with the county response team, have coordinated support resources for our county. So with no further ado, Kim Johnson.
Hi, good morning, everybody. Thank you again for having me today. Next slide, please. So, as Wanda mentioned, who is this Alameda County Emergency Child Care Response Team? On March 17th, the leaders of 4Cs, Bananas, Hively, First 5 Alameda, the County ECE Program, the County Social Services Agency, the County Office of Education, and Alameda County Public Health, we met with the purpose of supporting providers and families during the shelter in place. And we have been meeting every single weekday since then. And at some point we decided we needed a name. So hence the Alameda County Emergency Child Care Response Team. And as Wanda said, we got together to make sure we can support you. So I'm going to talk a little bit about the supports that are available to you. One thing that we hear once the provider decides to open is, how am I going to keep my classroom clean and safe? Supplies are an ongoing and additional cost and often hard to come by. The state of California set aside $100 million statewide to support this expense, and the R&R organizations across the state received half of that allotment to distribute to family child care homes, child care centers, friend, family, and neighbor providers, and license exempt centers. We've been distributing stipends and supplies since late May. So if you're a provider listed on the top 4 bullets of this slide, you can get stipends and supplies, and we have them until we run out. The other $50 million was designated for school districts. And I've inquired, but I'm sorry, I don't have information about how and when those funds will be distributed, but there is $50 million set aside for school districts. And for Head Start sites, it's my understanding that the supplies are being funded by Head Start and the City of Oakland. Next slide, please. So one of the tasks of the response team that we undertook was to distill all of the information that was coming from every direction. It's all great information, but it's like drinking from a water fountain or water hose, actually. So we were trying to distill information from the CDC at the federal level, all the different state agencies that we abide by, and of course our local public health departments. So we hosted several webinars, we created lots of online material, and when you get all of these websites that we're sharing with you today, I suggest you bookmark a few of those. There's one website that we put together that I'm going to share with you next called Reopening Childcare. Of course, Lisa, as she mentioned, you're going to want to bookmark the Alameda Public Health Department website, and then also the State of California COVID-19 guidance for child care providers and programs. So don't worry about trying to capture all this right now. I believe they're putting some of those links in the chat box right now, as well as they'll be included in any follow-up email that you're going to receive after the webinar. So the other program we're really excited about is the Health Heroes for Childcare. This is a partnership we created with Samuel Merritt University. They're one of the largest educators of registered nurses in the Bay Area. Their pediatric nursing students are providing support to childcare programs. We launched the program in June and have had over 150 student nurses supporting over 100 childcare homes and centers that are open. The program has been very well received and appreciated, and providers use them in a variety of ways depending on what the provider wants and needs. Next slide, please. So on this slide, I think you'll see, here are some of the student nurses at a center here in Alameda County. And the providers use them however they need to use them. So as Lisa talked about, the assessments and check-ins, so they've assisted with that. They've assisted with assessments, with check-ins, with implementing best practices. They have also developed really creative, fun, and age-appropriate games, videos, and songs to convey healthy practices. One example is a really creative video directed to kiddos, just demonstrating how germs are spread and how they can protect themselves from them. The support these nurses can provide can be done in person, as the photo conveys, or virtually. The nursing students have a wide range of languages, and we have been able to match providers with their language of choice. Next slide, please. So this is the homepage of the Reopening Childcare website, Growing Back Stronger. And this was developed by the response team, and specifically by Angela Cabrera. And she put together this website with a lot of great resources. There are 4 portals on this site. There's a management portal that really deals with the day-to-day about running a business, running any kind of organization. So there's information about human resources, resources as an employer, and business development. There is a programmatic portal, which includes information about health and safety, social emotional supports, and professional development. There's also a portal that has links to all of the federal, state, and local websites. So their websites links for CDC, the various state agencies, and the Alameda County Public Health Department. I think, however, you're going to spend most of your time in the best practices portal. In this portal, there are resources for tools that you're going to want to use with your families. For example, there's a checklist for families returning to care called My Teacher Wants to Know. There'll be tools there you can use with your staff, so they can have guidelines for physical activity for childcare and school-age care. And then we have all kinds of tip sheets. And these resources, many of these resources have been developed and shared by your fellow providers who have been open for a while. Next slide, please. So here's an example of the quality and types of tip sheets that you're going to find on the website. Next slide, please. And these are some useful online resources. Again, don't worry about taking a screenshot. These are going to be provided to you in the chat, and then we're also going to provide them to you in our follow-up email. Next slide, please. So last year, you know, you guys got all kinds of swag when you came to the symposium we had at the Hilton. You got sweatshirts and books and all kinds of wonderful things. Well, we can't do that virtually, but we did not want you to leave without a special gift from the organizers and sponsors of the symposium. So every participant will be receiving a reopening kit with all kinds of useful goodies. So we have cloth face masks. We have a box of disposable face masks, a gallon of cleaning solution, regular old garbage bags, you need a lot of those, and we have those coveted Clorox healthcare grade wipes. We also have a cute little puppet you can use to engage your kiddos, whether you are teaching in person or virtually. And then everyone loves sticker sheets, of course. And as LaWanda has been talking about, and we've all been talking about from the very beginning about self-care, it is so important that we take care of ourselves. So we've included a wonderful aromatherapy candle for you to use for whatever you do to relax. The candles have take me away names like Beach Linen, Lavender, Sea Salt Orchard, Day, and Love Spell. So we hope you really will enjoy those. We hope that you like the kit we put together for you. When you receive your follow-up email, there will be a link for you to sign up for your pickup time for the box. They'll be at our location at Bananas. We have 2 dates, Tuesday, September 15th between 2 and 7 p.m. and Saturday, September 19th from 10 to 1. All these pickups will be touch-free and safe. So we hope you come and pick up your takeaway box and your reopening kit. And I just want to thank you for all you do for our youngest learners. We appreciate you so very much. Turn it back over to you, LaWanda.
Hi, Kim. Thank you very much for sharing all of the great resources, the self-care kit and reopening box. And now I'm going to actually transition to Christy Herrera.
All right, thanks everybody. So we want to take some time to answer some questions, and we want to hear your voice. So if you would like to ask a question to Kim or Lisa, who has presented, or any question that might be on your mind, we would really encourage you to raise your hand, and we will go ahead and unmute you so you can ask a question live, or feel free to put your question in the chat. So I'm going to mute myself and wait for our amazing host to see who would like to speak.
We did have some questions in the chat for Lisa, just to get us started while folks are thinking if they have any other questions. Lisa, so there was a question about if kids have asthma, should they wear a mask? Are they required to wear a mask?
Yeah, I think that's a good question. I'm just going to state kind of the obvious that I'm not a healthcare person, so I don't want to, answer individual questions about, which kids should wear masks or not based on their own, health circumstances. But I would I can bring that question back to our doctor, Dr. Gerling, at Public Health. And I'd also recommend that family consult their health professional to determine that. So I can't, case by case, I think, in that situation is what I'm going to say.
Great, thank you. And then there was another question. There's lots of questions about the 6 feet apart.
Yeah.
And if kids need to stay 6 feet apart when they're in the center, and like, where does it from the outside?
Yeah,
of
course.
Of
this question comes up a lot. And as I mentioned, it's very difficult to get little kids to social distance or to physical distance from each other. Again, we, I think, are trying to encourage that they physical distance. And I know this isn't black and white. We want some things to be very black and white sometimes, but it unfortunately is not like that. We're encouraging physical distancing. So, try to plan activities that maybe aren't, like having kids together, you know, try to plan activities that encourage physical distancing, but it's okay if they aren't able to at all times. And again, that's why we have this cohort model in place. That's why the cohort model is so important. It's to protect, especially the younger kids, because we know that they're not going to be able to physically distance. So I don't know if we have time today to get into all the different, you know, ideas or recommendations around how to physically distance, but I think that also may come later today in the webinar, right? Like actually hearing from providers that are doing it, maybe using getting some of those ideas. I think that would be great for that.
Right, you're right, correct. Do we have any, I think we don't have any raised hands yet.
I don't see any raised hands, Priya, so.
There's one question about the last scenario, Lisa, about the time lag between sending the child home and verifying the positive test result. What do you do in that time lag?
Yeah, that's a question that comes up a lot. I think for little kids, it's a little tricky, but the kinds of things the questions that we'll ask our communicable disease department in that situation is, or what they'll ask, the communicable disease department will ask that we ask to really get more information about the symptoms if we can. I think that's the only thing you can really do is that, you know, find out more about exactly what symptoms they have. Sometimes the communicable disease department will ask, you know, they lose their sense of taste or smell. That's kind of tricky with little kids. You can't always ask them those questions. So it's not a super easy process, but we do try to just refine that information and, you know, work with a healthcare provider around, you know, what their thoughts are on if it could be COVID or not. But, and also want to put out there that little kids, what the research is showing is that younger kids are less likely to get COVID and also to transmit it. So that's something to also keep in mind just during this time overall. Yeah.
Great, thank you so much, Lisa. I really appreciate it. I want to transition. I think this is a good time to transition to talking to providers in the field who are open and what that's been looking like. So I'm going to introduce Charlotte. She's one of our amazing family child care providers. Charlotte is the owner and director of Rose's Daycare in Oakland, California. She's the vice president of Alameda Professional Child Care Association. She believes in promoting the child and family and the community with the main focus of quality care in early childhood education. Charlotte's motto is each one teach some, always encouraging others to learn and reach their educational goals. Charlotte is the 5th degree black belt in martial arts and has over 40 years and enjoys teaching children and adults. We've received a lot of questions around social distancing during registration, and Charlotte is going to try to address some of those today. So Charlotte's going to answer during the registration for this workshop. We asked registrants if they had any questions, and again, the main one was specific tips on physical distancing. So Charlotte, please go ahead.
Hello, everybody. Thank you for having me. I closed on March 13th and I reopened April 1st. And that was one of the main things that I focused on. And one of the first thing that I did, and I did a lot of research, I changed my environment. So if you're not open, you can think about what your environment looked like when you left and what it can look like when you come back. So thinking about this, whether you're open or closed, just think about adapting, modifying, and changing. We have to change. We cannot stay the same. I had 2 big tables, great, nice lakeshore tables that fit 8 or 10 kids. You know, we can no longer have that. I took one out. I'm using smaller tables. Something else that I recently, and they're not new, are lap desks. They're called lap desks. Lakeshore has a beautiful one, kind of pricey, about $79. I did research. Michael's has them, and they're plastic, and you can wipe them and clean them for $7.50. These are nice 23 by 11. They go over the kid's lap. They can crisscross applesauce. You can social distance without having a bunch of bulky furniture. So say if you have your small groups. Now we're not doing the 14. And with me, I have 8. So I have 2 groups of 4. And that makes it much easier. So if you're putting the little lap desks around the room and putting great creative resources on them, like if the kids are outside and they come back, oh my God, they see a lap desk with a puzzle. You are directing them and encouraging them to social distance. So when everybody has their own creative knacks, right? So when kids leave one environment, I don't care if you've done toileting, they come back and they see really cool puppets on tables and things. You're actually setting the environment and you've social distanced them, because kids do want to be, we've taught them to hug, build relationships, participatory play for years. Now we're saying, stop it. But you want to be very gingerly. You don't want the kids you can't say, no, go over there. You want to use your kind, your sweet voices to continue to, I don't know what happened. Sorry about that. It just took me off. But you want to be very gingerly when you're assisting children to social distance. But when you're setting the environment, the kids will go there. They love new things. And we have a lot of resources. You don't need to go out and buy a lot of things. Say your puzzles, your alphabets. But I will say, when you think about your school, your daycare settings, use things that are easy to clean. Okay, that's another thing. We got to do a lot of cleaning, a lot of sanitizing, keeping kids in the same bubble. So that's very important. And you're going to have to, you can use table markers or nameplates, and 3 to 5 year olds, they know their name. And once they see, wow, this is my table, or using floor markers. A lot of preschools, daycares, centers are using floor markers. And that really works. Like your spotters, the little circles with the different colors where you put around your rooms. Those are great for social distancing. Some daycares and centers, like if you have outside space, they make circles, rectangles, stars, and different things out of chalk. So when kids go outside, promote activities that promote social distancing, like Charlotte's in the rectangle, Bob's in the triangle, Harry's in the square. We're going to do freeze dance. You got music where kids are having big fun, but they're in the space. They're in that circle. And that allows them to have fun. There's social distancing. You can do, head, shoulders, knees, and toes, different songs. And you can also take a break outside when we have our great air back, and just read a book. Okay, everybody sit down and you take a sit and you look, okay, if you can't do 6 feet, well, if you can do 3 feet. I know that centers, daycares, we're all different, but you're going to have to look at your situation and kind of adapt to your personal situation. For example, some daycares, you say, we can't take all of our furniture out. All the furniture you have, by the new standards, half of your furniture needs to come out of your school. But you have to try to use your walls, use your storages. If you can, put some tables away, then bring them back. All these centers that we had set up, you might have to take half of them down. So think about ways that you can be creative and help your children. And one of the things that I like to say is make the learning fun. It shouldn't be the kids are going to be so excited to come back to school. They're going to be grabbing on your legs, and you're going to just have to kind of, give them, pat them on the back. And, you can't say, don't get close to me, because they're toddlers and that's what they do. And the same thing with our babies. But be prepared to adapt, be prepared to modify, share with your friends. We talked about we're a collective. We have, family child care providers. I have friends at centers. I'm a part of the Alameda Professional Child Care Association, which is a great resource. And if you're not a part of a child care association, please join one, because we connect with Bananas, First Five, and we do a lot of things to help our daycare providers, our center teachers, our Oakland Unified School teachers. We have all to do the best job that we can do. And number one is, safety. It's safety first. Safety for us, safety for our children. And we really want to make this a win-win situation. And I know I probably got about 5 minutes. So just think, kind of have a can-do attitude, I'm going to give you an example. I'm just going to say this and I'm going to stop. Try to fit the situation as it arises. Now, I'm going to use food, for example. I know everybody on this chat Zoom might not like tuna. Say you love tuna, okay? And you got your mind set on a great tuna sandwich on rye bread. You go in the kitchen and your husband done ate up all the rye bread. Now, what are you going to do? So you look in the cabinet, you got some crackers. You look on the counter, there's some pita bread. So how about adapting, changing? You're still going to eat your fabulous tuna salad, but you're going to put it on crackers. You're going to put it on some pita bread. So that's kind of what we got to do with the children. It's raining. You can't go outside for fresh air. Now put your spotters on the floor. Do some freeze dance. Do some singing. Do some choo-choo train. Hop from one 5-foot circle, and when you say go, the kid marches to the next one. So just try to be creative and continue to make learning fun and be your same creative self. And please don't give up. Don't give up on the children, because they really need us. And I know we're doing what we love, and we're loving what we're doing, and the parents and everyone needs us to keep the early childhood going. And I'm going to stop right there. Thank you.
Thank you, Charlotte. I don't know what it's been like. Lots of comments and questions in the chat, Charlotte, so make sure you're reading. Now I want to turn it over to Kate. Kate is the director of St. Vincent's Day Home, and she has some experience in providing care during COVID-19. She has been the executive director since 2017. She believes that early education experiences can be transformative for everyone involved, the child and the family and the staff, and play an important role in the much broader social change. She is super grateful to be a part of an excellent team committed to meeting the needs of children during these complex times. So, Kate, are you there?
I am. Thank you. Thank you very much. Good morning. It's nice to see you all. Happy Saturday. Nice to be with you. I'm happy to see some of my team here. So if you have any questions in the chat, please feel free. I'm happy to answer them when I finish speaking, but I also have some great teachers here who are also happy to give an opinion as well. So good morning, Wida. Good morning, everybody. We opened, well, first I just want to say St. Vincent's Day Home has been in West Oakland operating childcare and providing childcare since 1911. So we've been around a long time. We were here during the 1918 flu. So this isn't our first go around with this, but of course no one remembers that. And this is all brand new to us. So we had to adapt just like everybody else. We opened on July 1st, to 90 children. We're a large center. We previously had 210 children, and we are now up to 105 children and launching our home-based program in a week or two with 45 children. So we're up to about 160. I was asked today just to speak briefly about a couple of things. One was really what influenced our decision to return when we did, and then 3 strategies that really helped us and have helped us in this time. So I'll answer the first question just by saying that I think we felt ready. Our teachers felt ready. We wanted to return. We did a lot of work, all of us, for those months that we were not necessarily at the site preparing. And we followed, the best guidance that we could, and we set up our plan. And then in June, our teachers came back for 2 weeks before we opened, and we had time to reset our classrooms and our yard and really get our environment ready and to practice kind of what it would be like with the extra sanitation and practice staying in our bubble and whatnot. So we felt ready, and I think part of it was that we know, there are many, many children who really need childcare to thrive. And we were ready to come back and fill our role with that. We wanted to support working families, and for the most part, it's working families who have come back because we have space limitations, of course, and we've prioritized those families. I would say all in all, it's been a positive experience. I just have to take a minute to honor my entire staff. Our teachers have been amazing. They've come with a really positive attitude, as I know all of you will as you return to the classrooms. I just want to say what I've seen in the last 5 months, certainly not just at my site, but throughout the entire community, has made me so proud of everybody here. The dedication to children is amazing, and what folks have done is truly outstanding, the distance learning and all the outreach to kids. So just think it's important to take a moment sometimes to just say we're doing a great job because we care. The 3 strategies that I wanted to share with you, Charlotte spoke a lot about environment, and she just has some wonderful strategies for that. We really followed the CDC guidelines, as I know that you all will, and really reshaped our environment to have washable surfaces, washable toys. Of course, our children are in fixed stable groups, which we call bubbles. And our adults, of course, are all wearing a mask, sometimes face shields, like when we're doing check-in and we have more exposure to families. Families don't come very far into the day home anymore. We do the screening and they come on in, but only so far, and then teachers take them to the classroom. This does the job of minimizing the number of people in and out of the day home all day. It doesn't bode well for family communication, but I'll talk about that in a second and how we've adapted around that. So that's how we've adapted our environment. Of course, we've made some changes on the playground. And when I finish, I'll put in the chat a couple links. You can follow us on Facebook and Instagram, and you can see that we've posted some videos, and we just did a virtual tour, and you can kind of see how our yard and our classroom has changed. We also went to moving everything to individualized materials. So every child has a dish bin with their name on it. They have their own markers, their own sensory. And that's pretty much our strategy. I know teachers do a wonderful job kind of encouraging children to socially distance, especially at nap time, mealtime, circle time. But the rest of the time, we really made a decision as an agency to just encourage children to play safely with one another and stay clean. And, we didn't want to really have to, I don't want to use the word police, but we didn't want to have to really lean heavily on children to kind of follow after them to socially distance. That increases their stress level and ours. So we wanted to keep things calm and allow them to just really just play together as they have. And it's been so encouraging. The children came back and there was very little separation angst, and they were so happy to get back to playing outside with one another. So that's great. And we're starting our 3rd month with no COVID issues. So no positive cases. And I think that the system really is set up to work. The second thing I'll say is that I don't think there's ever a time than now that self-care is more important. So we are all helping people, loving people, joyful people, and we serve our children, we serve our families, but you can't pour into another cup if you're running on empty. And so this is a hard time, and I think it's important to acknowledge this is a time for many of us when our fear is high, our grief is high. It's not just COVID, it's excessive racial violence, it's the protests, it's the fires, it's children at home that you're trying to take care of, buying groceries for your families. I mean, all of the additional responsibilities on top of life already. So this is a time to really think, I think, how we regulate ourselves, what is our practice around resilience, so that we can reduce our stress and we can improve our immunity. I think one of the concerns coming back to work is, will I stay safe? Will I be healthy? Will my family be healthy? And the best way to stay healthy, other than washing your hands and wearing your mask in this time, is really to not run yourself down so far. So really taking time, whatever it is, you take a walk with your girls, you take a phone call, you know, a long bath, however it is that you balance out yourself so that you can come to that place where you recognize your joy and your love in things. That's really the beauty of the preschool classroom, right? There's just so much love and so much joy to share, and that's how children thrive. But if we're locked into a certain place, it's hard to bring that. So everyone has their own way of doing that. For me, I found that I had to get off my phone and get some more sleep. So, you know, whatever your strategy is, go for it. And then the third thing that I think is really important that we've really worked hard on is communication. So not just communicating with each other about our own needs and where we need grace and where we need some additional support, but really doing our best to communicate with the families. We've done a lot of texting, a lot of Google Docs, texts that link to Google Docs, because that seems like an easy way to share information. And because we don't have parents dropping children off in the way that they used to and picking up, that time to connect with teachers isn't really there. I mean, it slides in a little here and there, you know, as we're taking children to the door and whatnot. But for the most part, our teachers have done a really great job. They just did their back to school nights on Zoom. And so they got to show parents the classrooms, and that was fabulous. And they had a really great interaction. And I think, and day home teachers, you can pop into the chat on this one, but I think that we had even better attendance on Zoom than we do, you know, in person, because it was easier just to log on. So that communication has been really helpful. I know teachers are calling more, some are texting, some are sending pictures home. We're starting to learn that how we can use the Learning Genie to communicate a little bit more with families. So families are really appreciative of that dialogue, and we're encouraging families to email, to call, you know, if they have questions or they want to talk about their child. Everyone's just doing the best that they can, and it's really, it lifts my spirits to know that sometimes the best you can do is perfect. It's just enough. You know, the children are back, staff are well, so when we leave for the week, we say that's another week well done. You know, we met our goals. So I'll just stop with there. If there's any questions, just pop them in the chat for me, and I'm happy to answer. And also, I do want to say one thing. I'm going to put my email in there, and sometimes it's nicer just to take a look at things. So you can hop on and look at our virtual tour on Facebook or Instagram. But if you want to email me, I'm happy in the next couple of weeks to just take a Zoom call with you and kind of walk you through the day home and show you classrooms and the yard and anything else that would be supportive for those of you who are transitioning back into the classroom. Thanks.
Thanks, Kate. That's a really great idea, and thank you for offering that. I'm sure people will take you up on that for sure. So we're going to transition to actually what's happening in Oakland Unified. Then we're going to have a little bit of time for question and answers, and then we'll be spending the rest of our time together in small breakout rooms. So I'm going to talk briefly about what is happening in Oakland Unified. We are doing a full distance learning right now. We are part of an LEA, and so all of our elementary, middle, and high schools are closed. And so we also follow those regulations, the school district, so we are closed currently. Like I said, all of our teachers, instructional assistants, special education teachers, paras are all doing distance learning. Our teaching teams are truly engaged with families. We are working to make sure that we're getting devices for all of our preschool and TK families. That is a super important piece. That digital divide was really focused on K-12, and so we've been working with some amazing funders to make sure that we're getting devices for our pre-K and TK teachers and our families. We're offering super high quality professional development for all of our ECE staff. We continued that through the spring, and we'll having that happen throughout the fall. We are really focused this year on our anti-racist teaching practices and what does that mean to be an anti-racist teacher and educator. We're deeply committing to getting our families resources. We have grab-and-go meals in Oakland Unified for all OUSD students. We're working closely with our Oakland Housing Association, Keep Oakland Housed, the Undocumented Relief Fund, and Oakland Housing Authority. We're also working closely with families to get access to the internet. So Comcast and AT&T have created affordable plans for families, specifically in Oakland, and we're really committed to making sure families are connected to those resources and really viewing internet and computers as a utility, just like PG&E, lights, water, that this really is something that everyone needs and should have, and how do we create that in an affordable way for all families? We are also highly committed to continuing collaborating with Alameda County Public Health, with our partners, our CBOs who are open, who are starting to open, so that we can learn from each other and work with each other. So I'm truly honored and proud to work for Oakland Unified and support our amazing teaching teams and staff. It's truly the best job I honestly can think of. So we want to slowly transition to having some more questions and answers of Charlotte, of Kate, or myself, and then we will transition into our breakout groups. So again, if you want to put your questions in the chat for Charlotte, Kate, or myself, we'll be happy to answer them. If anyone wants to be unmuted and ask a question in person, we're happy to have that as well. The grab-and-go sites are only specific to OUSD children right now, although they are partnering with the food bank to connect families who do not have students in OUSD. Just saw that question in the chat. But want to pause for a moment and be able to answer any questions that we may have seen, or if Priya, if you want to call any of them out.
Yeah, sure. While folks are thinking, there's a couple questions in here that folks asked about the bad air quality given the fires. And Charlotte and Kate, how have you handled the bad air quality and outdoor playtime given the bad air quality?
We've spent a lot of days staying inside. So if it goes up to like 90 or 100, the AQI, we tend to stay inside. And so our teachers have just been really creative and, you know, given children lots of opportunities for indoor play and movement. And then we just wait and pray for the wind to blow.
Mm-hmm. Right, thank you. And do you have air? There was a question about the HEPA air filters and.
Oh, I wish. Yeah, I think we all wish. We don't have anything fancy like that.
I have a wonderful, let's see, can you hear me?
Mm-hmm.
Yes.
I have a wonderful parent who brought me an air purifier and for the room, and it works great. And with the air's bad, we stay in and we just get creative, just like rain. If it's not real bad, I still open the window for, you know, a little bit for some ventilation, cross ventilation, and then we close it. But if you can, and I know with everything we're doing around COVID, finances are an issue also. If we could just get everything we needed, it would be a great world. But that's what we're doing.
Thank you, Charlotte. There's a question, Christy, for the OUSD pre-K online learning. How does it work? What are the hours and family?
Yeah, so the traditional school day was shifted to 8:30 to 3. Students get a minimum number of live minutes every day. So our pre-K, TK, and K students get 80 minutes 4 days a week, and then 60 minutes on Wednesday. It's a big focus on family connection as well. Obviously, we can't be doing Zoom instruction without an adult or parent supporting during that work. We also are working closely to make sure families have access, right? So we can have amazing distance learning, but if our families aren't able to access that distance learning, that's our big push right now. But each teacher and teaching team connects with the family and gives them the information on when Zoom circles and circle time and small group instruction will be happening.
Thank you. And I don't know who has information on this question, but there's a question about funding availability for childcare centers that need to redesign their space. I'm wondering, maybe Kim, do you have any info on that?
Well, it's limited. There have been some grants that have been made available philanthropically. And so I know about 20 grants actually were just released last week to some childcare home providers in Oakland. And there is talk of additional funding coming down to provide additional funding for childcare providers. There's not enough for the need. I will tell you that for sure. But there is a lot of conversation going on because we recognize that, when I say we, the sector recognizes that as a true need, and so that there are, one-time grants and funding for providers to use as they see fit for their settings. So that's all I have right now. We do put it out when there is funding available. We do send it out to all providers for applications.
Wonderful, thank you, Kim. So we will, like we mentioned before, we will continue to answer questions, send follow-up information, any sort of resources or information we've shared, we will push out to the email that you registered with. And now we're going to be transitioning to some breakout rooms. So we're going to spend the rest of the time, people have been randomly put in breakout rooms. For those of you who need Spanish and Cantonese, we'll put you in rooms that are accommodating to the language that you requested. Make sure that you are able to participate in your breakout room. When you see join breakout room, make sure you click that. There'll be a facilitator in each room. And they'll go over what's going to be expected in the breakout room and help you all have a good conversation together. Once you see that statement that says join breakout room, make sure you select it. If you're on your phone, you might have to swipe to the left. If you're on an iPad, you should be able to see it. All right, everybody, we're glad you're back. We hope you enjoyed the breakout sessions with your small group. We are going to be transitioning to end our wonderful time together. We really, really appreciate you all being with us this morning. I am going to pass it back to Priya for some closing statements, and then to Luanda.
Thanks, Christy. Welcome back, everyone. Hope you had a great time in your breakout group. It's so important to have time to connect with each other, and I look forward to learning more about what you all discussed. Wanted to announce that we have 2 more raffle prizes. Again, these are from Lakeshore. They're gift certificates and then some materials. And the two lucky winners are Jacqueline Jackson and Chloe Chan. And so again, I will email you and we will figure out how to get the raffle prizes to you. Congratulations. Thanks for your participation. And I will turn it over to Lawanda to close us out.
All right. The Saturday is almost coming to a close. Thank you again for being a part of this Saturday. And just as a reminder to you, we just want to let you know that you're going to receive one email today. And in that email, there are going to be a number of items. One really important for us is the post-evaluation. It's really important for us to have feedback about how this was for you, what you would like to have offered in the future. We have 3 more webinar series and we want it to be meaningful. So please complete that evaluation today if at all possible. And then also for those of you who are participating in AB 212, which is now the new Workforce Development Grant, it has a new name, but we will be issuing AB 212 certificates. So be sure to look for that. And then also for those of you who want to get your reopening boxes from Bananas, please be sure when you get the email to sign up for that so that we can make sure you're a part of that and you can pick it up. And if that's a problem, we'll try to work to get it delivered to you. And then also there are a number of resource links that was shared today that were very valuable. Many of you asked for it. We will be sending those important links out to you as well. And then in a few days, please, probably more likely at the end of next week, of this coming week, look for questions, responses to your questions that came up. Really important questions were shared, as well as look for the recording to this session. So we'll send you an edited version of this recorded session. And then we would be remiss if we didn't say thank you to our philanthropic partners, both the Rainin and Packard Foundation. We could not have done this without you, and of course the amazing planning team. And then that comes to the conclusion of our meeting. I do want to read one quote to you that really stands out for us. And that quote actually comes from Michelle Obama. And the quote reads, "Kids wake up each and every day believing in the goodness of things, in the magic of what you might be. They're uncyclical believers at their own core. We owe it to them to stay strong and to keep working to create a more fair and humane world. For them, we need to remain both tough and hopeful, to acknowledge that there's more growing to be done." So I think that resonates with the collective today, and I know that your breakout groups resonated in that way, that we're going to stay tough and we're going to stay engaged and yet nurturing in this work. So I wish you all well, and I hope you enjoy the rest of your Saturday. And if any of our co-planners have anything else to share as parting words, please do at this time.
I just want to really echo Lawanda's appreciations and also say thank you so much to Lawanda and to Christy for the fabulous facilitation of this meeting. Really appreciate you holding the space for us. Thank you. And should we put everyone on mute, unmute everyone so that they can say goodbye and
Absolutely.
Yeah.
Sure.
Bye. Thank you.
Everyone.
Bye.
Bye, everybody.
Bye.
Facilitator today.
Have a great weekend. Bye.
Good day,
Yeah.
everyone.
Bye, everybody.
Bye.
Enjoy yourselves.
Bye. Thank you.